Welcome to MedAxiom HeartTalk, the podcast where cardiovascular thought leaders come together for one ultimate goal: to continually advance cardiovascular health care for all. MedAxiom HeartTalk starts now.
Hi, I'm Joe Sasson with MedAxiom Ventures, and today with me I have Dr. Amit Amin from Washington University and Barnes Jewish Hospital in St. Louis, as well as Gary Clifton, Vice President of Terumo Business Edge. Gentlemen, thanks for spending some time with us today. I really appreciate you taking some time out of your conference schedule to sit with us and have a conversation.
Sure. Happy to be here.
Now, Dr. Amin, recently you've been publishing a lot of articles and doing a good amount of research in cath lab economics. Would you mind sharing with us what's motivated you to engage in that work?
This topic is really, I feel, one of the most important things that needs to be researched. A lot of my research is on value-driven care of PCI, and by that, the value equation, as you know, includes not only good outcomes, but how can we deliver these outcomes at a low cost? So it was but a natural extension of my research to also focus on cath lab economics, and that has been a big driver for me.
Excellent.
Dr. Mann, I'm curious, and when I look at all your research, same-day discharge seems to be a central focus. Can you elaborate?
Gary, the same-day discharge process is underutilized in this country, and I feel it is a very valuable tool to improve the value of PCI, especially as we embark into these alternative payment models and consider bundled payments. It not only improves patient satisfaction, my patients love it, but the cost reductions are substantial. Until now, we didn't really know how much of a cost advantage same-day discharge can be, so we have done a few studies looking at the economics of same-day discharge. And in a paper from NCDR linked with the Medicare data, we found there was approximately a $3,600 reduction in the cost of PCI. This is the cost that hospitals spend to take care of these patients.
So that $3,600, that really strikes a chord with me, because I know when we talk to hospitals, they go, $3,600, how is that possible? I know you really dug into the costs in your particular facility. Can you expand on that a little bit?
Costs are difficult for hospitals to understand, and even for a big system like ours, we have some difficulty understanding our costs. But the $3,600 number comes from Medicare cost to charge ratio, so it's a very reliable estimate. It involves a reduction in complications, it involves a reduction in room and board charges, and everything associated with room and board. This includes nurses' salary, physician salaries, all the equipment, the lighting and food and cafeteria, and every other expense, both direct and indirect, involved in the care of the patient. So some hospitals, I think, confuse that number with just their room and board charges. And I want to be clear that it not only involves room and board charges, but everything else that is associated with that extra additional day of care in the hospital.
Wow. And is that something that your organization has verified through working with the CFO and the accounting team? Because it's a big number and it sounds very complex in terms of how you arrive at that.
You're exactly right, Joe. It is a complex number, and different hospitals are different. The 3,600 is an average across Medicare hospitals in the low-risk population. At Barnes Jewish Hospital, we've extended that to the higher-risk population. So because of our same-day discharge protocol, which involves sending home patients who are more complex or require more care, when we send them home same day by aligning the care in such a way that they are able to go home same day, we actually save even more than the $3,600. So from the Barnes Jewish Finance Department, when we looked at our cost data, we are finding about $6,000 to $7,000 savings for our same-day discharge patient. That paper was recently published in the Journal of American Heart Association, and it does show a pretty big impact it could have as you expand your same-day discharge program beyond the low-risk population to a high-risk population.
Wow.
So I guess finally, I mean, what would you tell any hospital wanting to pursue this?
Look, the exact number of dollars doesn't make a big impact. I would make a broad statement that same-day discharge will save significant amount of costs to your hospital or to your organization, and so aligning processes, aligning care in such a way that you have a streamlined standard process of treating the elective outpatients via rapid pathway and then same-day discharge could result in substantial savings, especially in the bundled care era.
So I have one more question. I mean, as we sit here and talk about the costs, which are significant, whether it's $3,600 or $7,000 a case, patients are a little bit protected from that cost structure, that the organization is able to save that money. But the patient is really affected by is going to be that patient care experience and the quality of care that they receive. Can you tell me a little bit about what you've seen in terms of that patient care experience and outcomes changes as you've transitioned to a same-day discharge process?
Patients love going home same day. And so we track patient satisfaction very closely. And when we did a survey of our patients, almost 90 to 95% of them reported excellent satisfaction with going home same day. So you're absolutely right that the co-pays that patients have for their elective PCI really depends on their insurance, and it has little to do with hospital economics. What we have focused on in our research is the hospital costs, not the patient costs. The hospital costs are substantially low.
Well, I appreciate it. Thanks for taking some time out to have this conversation. Gary, Clifton, greatly appreciate it.
Thank you so
Dr. Amin,
much.
thank you guys both so much. And I hope you enjoy the rest of the conference. Thanks for joining us.
Thank you.
You've been listening to MedAxiom HeartTalk, the podcast where cardiovascular thought leaders come together to advance healthcare. You can follow MedAxiom on LinkedIn, Twitter, and Facebook. If you haven't yet, please be sure to subscribe, rate, and review this podcast. Join us next week for another MedAxiom HeartTalk, and thanks for listening.